Senator, thank you very much. And for those of you who are gathered here today, it's a story about a family that tens of thousands of other American families are going through. The awareness by members of Congress on the House and Senate to address not just a public policy issue, but really a public health issue is vitally important to families all across this country to give leading edge information about a danger that is happening right before our eyes. THC is an addictive component. It is an addictive part of products that find themselves on shelves in American homes and by and large talked about perhaps in favorable ways, certainly by younger people who found that this compound is causing an addiction to them that they think is normal and regular, and yet families and psychologists and psychiatrists and law enforcement see as a mental health issue. There's got to be a determination by this federal government to objectively look at the facts of the case, to develop them, and to make sure that the American public is warned. That is what these resolutions are about in the United States Senate and in the United States House of Representatives. And we will be asking our colleagues and then the leadership of both bodies to come together to answer what is a cry of help from the American people, a cry of help from families who have lost loved ones, a cry of help from families who are today working through circumstances in their family, perhaps with professionals, certainly medical and healthcare related people, who will want to look at this as an issue that the United States government, that members of Congress and state and local officials can identify and come to a point of inflection to say THC is an active ingredient that is not only addictive, but it is dangerous to the growth and health of our children and to every American. Perhaps lastly, any sheriff, anybody that runs a prison or a jail in the United States of America understands that probably upwards of 20% of the people who are in their incarceration are there because of an addiction that most times began with THC. Some people call it just marijuana. It is not just marijuana. It is in gummies, it is in products, and they are being made for addiction purposes. So, I applaud the people who are standing strong today. I applaud the families all across America who want to hear the answers. And we believe today what Senator Ricketts and I are doing is to put a resolution forward to challenge the federal government, state and local government, and families across this country to hear the truth about THC. I dropped my bill last night. Expect us to get co-sponsors to have the debate, to see how government correspondingly replies, and for us to move forward as a country, one nation under God.
Another dangerous industry harming our kids and our country's future. That was Texas Congressman Pete Sessions, along with Nebraska Senator Pete Ricketts on Capitol Hill earlier this week, unveiling the first concurrent congressional resolution outlining the dangers associated with high-potency marijuana and THC drugs that today are legal in many places and come in many forms, including drinks and candies. Those products can be up to 90% potent, 90% THC, and the psychological damage for users can be significant. It's called Randy's resolution, named after Randy Backus Jr. We're going to tell you why in a moment. But first, let's welcome in Randy's parents. Joining me now, Heather and Randy Backus Sr., both of you. Welcome to America Right Now, and thank you for being here.
Thank you for having us.
Heather, first, before we talk about what happened, tell us about Randy. What kind of a kid was he?
He was a really creative, humorous, funny, charismatic, personable young man who he had ADHD, but he just had a lot of energy, and he was very social and liked to have fun. But sadly, he started using marijuana, and it really changed who he was.
Randy, a lot of people say pot's harmless. It's not addictive. It's medicine. It's recreation. Your family found out that what the companies who push these drugs often say is far from the truth. I know that this is hard for both of you, but tell us what happened.
So basically, our son, when he was 21, after years of using high-potency marijuana, he encountered cannabis-induced psychosis. So basically, he was not himself. He was seeing things and hearing things that did not exist. Sadly, he took his life in July of 2021 and succumbed to suicide.
Heather, there is data now, and yet politicians want to make this stuff more available and accessible. The Biden administration is even thinking about rescheduling marijuana to make these drugs easier to get. Why aren't we learning our lesson here?
I believe it's industry-based, and so like our son believed the industry talking points that marijuana was medicinal. They highlight all the benefits, but they don't give the reality behind the product, which we all know brains aren't done developing until the age of 25, and that marijuana THC has an impact on the developing brain, and it's detrimental. It lowers IQ points. It can cause psychosis, suicidal ideation, depression, anxiety, and we already have a mental health crisis in our country. So why they're not listing, I believe it's industry driven.
Yeah, and I should re-emphasize that the pot products today have been scientifically proven to increase depression, suicide, IQ loss, schizophrenia, and psychosis. Randy, what's your message to parents and lawmakers about the industry, about big marijuana? They're starting to see the advertisements. They're starting to see this stuff pop up all across the country. What do they need to know about today's THC and marijuana products?
So many people that are in our age group and younger think that marijuana is this harmless drug. Simple fact is, do your research. Learn about these products. But these products today, they have potencies anywhere from 30% up to 95% THC. This is no longer the weed that we grew up with. This stuff is highly potent, and it really affects our youth. So I would say really do their research and their due diligence and understand that this is not this benign, harmless product. This is something that could really affect their family and their kids.
And around the time of Woodstock, I think that most marijuana was about 4 to 7% THC. Now the stuff that people are vaping in these cartridges and smoking is sometimes 40, 50%, even higher THC. Joining us now is Republican Congressman from the great state of Texas, Pete Sessions. Welcome. Before we get to the news of the day, the airstrikes over in Iraq and Syria, real quick for me, both you and Senator Ricketts introduced the resolution together that the Backus family was just talking about. What are you hoping to accomplish there?
Well, thank you very much. The cries that come from American families about not only the mental illness that is associated with this, but actually the marketing effort that takes place that is directly designed by the consumer. The consumer wants heavier and heavier doses. They want a higher high. This is an addictive product that the federal government needs to understand as an addictive product that's also deadly. It's deadly the younger you use it. Randy began at about age 15 using not just marijuana, but the active ingredient THC. THC at these levels over a short period of time caused a change not only in his mental outlook and behavior, it ended up taking his life. The cries for help is why Senator Ricketts and I are doing this.